Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 26, Phos-2. Phos for mouth symptoms. Ulcers in mucous membrane of mouth, stomatitis, or inner surface of lips. Use Km alternately. That is, you have to use Kp and Km alternately. Kp Phos, Km Calimute. Halitosis, bad breath. Fetid ulcer inside the mouth, bad taste in mouth, brownish coating over tongue. Like crushed mustard on tongue. In morning, tongue is so dry that it sticks to hard palate. Glossitis is inflammation of tongue. Spongy gum recedes. Gum bleeds easily. Edges of tongue red, inflamed. Phos for teeth troubles. Toothache for nervous and emotional subjects. Toothache after sleep, after mental or physical exertion. Severe pain in decayed or filled teeth. Phos from teeth troubles continuing. Toothache alternate with frontal headache. Teeth feel sore. Phos for throat troubles. Tonsils large and sore with white solid deposits like diphtheritic membrane. This is diphtheritic membrane. These are also diphtheritic membranes are there. White membrane formed during diphtheria. After effects of diphtheria, gangrenous malignant condition of throat, paralysis of vocal cords, loss of voice. Phos for gastric symptoms. Gastric ulcer from disturbance of trophic nerves. Trophic nerves means actually the nerve which lessen the activity of an organ. That is trophic nerve. Since ulcer, it is when this nerve is trouble and gives troubles in action, then ulcer may result. Gastric ulcer, disturbance of trophic nerve. Stomachache from fright of excitement, very thirsty, nausea and vomiting of sour, bitter food and of blood vomiting. Empty gnawing sensation relieved by eating, belching of sour and bitter gas, constant pain and epigastrium in a small spot. Epigastrium is a region in stomach. Not stomach but abdomen. Actually, the whole abdomen, this is the abdomen. The whole abdomen is divided into 9 quadrants. This is called right hypochondrium. This is epigastrium. This is left hypochondrium. Epigastrium means just below the stomach. Then there is this right lumbar region, umbilical region, left lumbar, right iliac, hypogastric, left iliac. This 9 quadrant, we must know this thing because very often this will be referred to and you must know what is what. That's why I give the picture of quadrants. Phos for gastric symptom containing unnatural hunger. Excessive appetite generally seen after fever. Eats heartily but appetite is not satisfied. Empty feeling around stomach. Flatulence in left side of the stomach near heart. Phos for urinary symptom. Frequent micturition with burning due to nerve region or partial paralysis of sphincter muscles. Incontinence of urine. Incontinence meaning the urine cannot be held. It leaks out. Nocturnal enuresis of children. Use Kp along with main remedy FP. This is very important and you will need this very often in a chamber. Nocturnal enuresis, nightly discharge of urine by children in the bed. Use Kp along with main remedy FP. Kp, you know, FP, ferrum phos, Kp, this medicine. But if the reason is worm, if you come to know that there is worms in the abdomen of the boy or rather children, then you give NP, natrium phos. Passing of blood, cystitis with severe weakness and prostration. This is the picture, corresponding picture. Just you just relate the things with these writings. Caliphos for urinary symptoms continuing. Nervous debility, sleeplessness and voracious hunger of diabetes along with other indicated remedies. KP is always used as an intercurrent remedy. See, this symptom may be there in other threshold also, but whatever your selection may be, KP, use KP as always an intercurrent. Intercurrent means mid, between two. Intercurrent means between two medicine, it is intercurrent medicine. In Bright's disease means actually inflammation of kidney. In Bright's disease, when albumin blood protein passes out with urine, this we come to know from the color of the urine. Generally urine color becomes yellowish or brownish. That is albumin is passing. To stop disturbance in nerve centers, KP is extensively used. So since it's developed in nerve, so KP always looked after nerves. KP looks after nerves seriously. So it's extensively used along with main remedy CP. Here, calcarea phos and caliphos. Calcarea phos and phenaphos are used conjointly. Color of urine bright yellow or brown. This is color of urine. And this is glomerulus of nephron. Just a picture within the nerve kidney cells, nephrons. Within the nephrons, this is seen. That picture has been given. This is actually anatomy. Caliphos for male genital symptom, sexually transmitted chancroid, an ulcer produced by bacterium Haemophilus ducreyi. This infection caused partial destruction of penis. This is partial destruction of penis. Balanitis, inflammation of penis. In gonorrhea, when there is hemorrhage from urethra, then caliphos show magic cure with a few doses of 6x. Please remember this. Hemorrhage is coming from urethra. Very serious condition. Sometimes patient faints. Doctor also get very much disturbed. Nervous seeing this sensation. But please take a deep breath and give a few doses of 6x caliphos. It will be arrested. Caliphos for female genital symptoms. Irregular, delayed. Too early menses. Too early, irregular, delayed, too early menses of irritable, emotional, pale ladies. Intensely obnoxious red blackish discharge which does not coagulate easily. Amenorrhea of depressed lachrymose, very weak ladies. During menses, legs ache, stitching all through pelvis, womb, dysmenorrhea. That is, caliphos looks after all the three types: dysmenorrhea, amenorrhea, and polymenorrhea. Polymenorrhea means too early. All type of menstrual problem in ladies are looked after by this KP. Caliphos for female genital continue. Hysteria during menses. Nervous weakness, excitation, as if a huge bolus of wind pushing up through throat. This is called globus hystericus. Huge bolus of wind pushing up through throat. It is actually feeling. It's not actually so. So this is called globus hystericus. Caliphos is the medicine there. Spasms of cries during hysteria. Acrid, obnoxious leukorrhea. Another thing, leukorrhea. That is three types of menstrual problem, mainly dysmenorrhea, amenorrhea, polymenorrhea plus leukorrhea. All are covered by caliphos. Caliphos for pregnancy symptoms. Threatened miscarriage in nervous subject. Mastitis with discharge of brownish, dirty looking, offensive odorous pus. Here, external application of caliphos is very effective. Since whenever there is any inflammation on skin, external surface, then use internal medicine and also external application. That is, powder the tablet, make powder of the tablet, and mixing with it, say some thing like glycerin or Vaseline, you make a paste or cream like thing and then apply it on the inflamed site. Then it will be cured very fast. Puerperal mania, childbed fever, febrile, ineffectual, spurious labor pain. This is extremely problem in the labor room. The persons, though in the present days, due to this cesarean section, this troubles is always avoided by taking recourse to cesarean section. But previously, I mean, when it was not so common, then this febrile ineffectual spurious labor pains, tedious labor with constitutional weakness was a very serious problem of all many ladies and as also gynecologists. Here, the the remedy is this: taking 6x 2 doses a day 1 month before EDD. EDD means expected date of delivery. Before expected date of delivery, ask your patient to take 6x 2 doses a day KP for 1 month. Then this trouble, this spurious labor, this tedious labor, this will be not there. The labor will be easy. Life case: Mr. Das, 40 years old, had been suffering from vomiting and watery diarrhea from last midnight. He took curd and crushed rice in last dinner. First two vomiters contain undigested crushed rice. Purging used to occur every 30 minutes to start with. At 9 am when I visited, I noted that the patient was receiving intravenous saline, pulse 85 per minute, BP 130/100, respiration 22 per minute, no fever, eyes sunken, but still water-like purging was going on. Whole room was full of foul odor. I asked the attendant to cover Mr. Das warmly and open the doors open. Because this is, the patient is suffering from hypothermia, because when there is serious diarrhea, so patient will be losing temperature. Hypothermia, there is some sort of shock. So you have to cover the patient with, so that the temperature is maintained. And I simultaneously open the windows and door to make the room airy, because that is full of foul odor. Prescribed KP 3x 10 doses. First 2 doses every 10 minutes, then 2 doses every 20 minutes, then 2 doses every 30 minutes. Last 4 doses every hourly. I returned requesting attendant to report after an hour. About 15 minutes after, I was informed that following the 4th dose, Mr. Das started sleeping deeply. Attendant asked if further medicine to give him arousing from sleep. I instructed not to disturb him in sleep, but when he would wake, to repeat rest of the medicine every hourly. See this? This is a very common case of gastroenteritis possibly. So KP always is there to help us. With this the video ends. Thanks for listening, viewing. If any problem is there, please write down in the comment section. I will certainly respond. Many